मैं तो YouTube पे लाइव नहीं दिख रहा मुझे, मेरे वाले फोन पे। अच्छा, ओके, देखता हूँ। Okay, perfect. Thank you. I think we're live now. Yes. So, I will be discussing today the NEET MDS recall questions for periodontics and implants. So I am able to gather some questions. So just help me out with some options if you know, or some other questions if there are some more questions, because I know there were some more questions that were asked, but we were able to gather these questions, so that I would be discussing. So if you can find some more questions and can put it in the discussion part, in the comments part, we can discuss about that. And if you find out that the options that are being shared here were different, you can tell that options also, so that I can accordingly discuss those options and can come to a answer. Okay. So the first question that was asked was, which of the following describes the coaggregation phenomenon in plaque? Okay, so it's a very good, easy question. We had discussed all this during our classes. So first of all, a coaggregation is a interaction. It is a stereochemical interaction between bacteria. Between the carbohydrate and the protein layers of the bacteria, and it has been seen that this interaction is seen mainly between gram-negative bacteria only. Okay, so this interaction is mostly seen in gram-negative bacteria. It's a repeat question. Lot of times it's been asked, and we have discussed this also during our classes and T&D discussions. So the answer for this first question would be A, gram-negative bacteria. Okay. This is the second question. Which of the following layers of epithelium comprise the stratum germinativum? Okay, this is the second question. Which of the following layers of epithelium comprises the stratum germinativum? So now the options which were provided are these. So I just need to confirm if these options are correct, because stratum germinativum is a name for stratum. It's a other name for stratum basale. So if you're sure about these options, because none of these options are 100% correct, so I would request you, if you know the correct options, so give me the correct option so that I can tell you about the correct answer. But for now I am telling you that stratum germinativum is the other name from stratum basale. So out of all these options, the combination of these options does not look correct. So it's difficult to come to a single answer according to these options. I am looking for some more options. Stratum basale and parabasal layer option were there. Okay, and parabasal, that's still a better option. So a stratum basale, and do you remember some other options that were there, or other options were from the same options that are there on the screen? The other options were same as the screen. This is the one other option that you are saying was there. So if you had stratum basale and parabasal layers, so what are parabasal layers? So basically parabasal layers are stratum basale and stratum spinosum. So it's a better option in answer here, if this is one of the options. I don't know about the rest of the options. So out of all these options, and the one option that Pranav has said, that was stratum basale and parabasal layers, so it's still a better answer as compared to these options. Okay. So this is question number 2, and the better answer would be stratum basale and parabasal layers if it is one of the option. The third question was, the reverse architecture of bone is most commonly found in. Okay, so first of all, what is a reverse architecture? A reverse architecture means that generally what happens, your interdental bone is higher and your interradicular bone is lower. So that is why the bone is scalloped. But when the interdental bone resorbs and the interradicular bone becomes higher and the interdental bone becomes lower, then it is known as a reverse architecture. Okay. Now the first important thing that you should understand, that in which of the conditions reverse architecture is found. So reverse architecture is found in trauma from occlusion. It is seen in chronic periodontitis. It is also seen in aggressive periodontitis, and it is also seen in necrotizing ulcerative gingivitis. So was the question reverse architecture of bone is most commonly found in, or it was the question like reverse architecture of bone is not seen in? Because if I tell you out of these four options, TFO, chronic periodontitis, even necrotizing ulcerative periodontitis may have reverse architecture. If I have to choose a single best answer out of these, the answer would be chronic periodontitis. Chronic periodontitis has maximum chances of having a reverse architecture. So out of all these options, chronic periodontitis is a better option. The second best answer would be TFO. If aggressive periodontitis was one of the options, the third best answer would be aggressive periodontitis, and the fourth best answer would be a necrotizing ulcerative periodontitis. So if someone can confirm the options, if you remember it, just let me know the options so that I can tell you what would be the best answer. But with these options, chronic periodontitis is definitely the best answer here. Okay, so the next question, according to the Marin classification, a patient who reports for a surgery, for a patient who reports for a year after periodontal surgery with less than 50% bone loss falls into what? Okay. So again, this question is not a complete question. There are some things that are missing in this question. So first of all, what is this Marin's classification? This Marin's classification is basically given for a recall visit for the patient after any periodontal therapy. So he divided this into three classes: class 1, class B, and class C. So class A patients were the patients who had excellent maintenance even after 1 year or after. Suppose you do some periodontal therapy, and even after 1 year, if the maintenance is very good for these patients, they fall into this category, that is class A. Generally, class A patients have good oral hygiene, no bone loss, and no teeth with 50%, or like he has asked here that how many teeth had 50% of bone loss. So in these class of patients, there is no teeth with 50% of bone loss. So basically that is class A. A patient with class A is generally recalled within 6 months to 1 year for a regular maintenance. Okay, so that is class A. Now the class B patients have reasonably well maintained oral hygiene. Okay, they are reasonably maintaining well after 1 year of the procedure, but they have some inconsistency in oral hygiene. Means the oral hygiene is okay but not very good. They are heavy calculus formation. There is heavy calculus formation, and there are two important points that you have to remember: that some teeth with less than 50% of the alveolar bone support, that some teeth have less than 50% of bone support, and more than 20% of the pockets bleed on probing. That more than 20% of the pockets that are found in these patients bleed on probing. So one important point: some teeth with less than 50% of the alveolar bone support, that falls into class B. And agar yehi option hota, some teeth ki jagah lot of teeth with more than 50%, lot of teeth with less than 50% of bone support, so then they will fall into class C. Now he has mentioned in the question a patient who reports for a year after periodontal surgery with less than 50% bone loss falls into what? Now in this question there is nowhere mentioned some teeth or a lot of teeth that falls into this. So do you remember, was there one more thing in the question where he has mentioned some teeth or more teeth were involved? Do you remember it? That how many teeth does he mention this also in the question, that the teeth were less or more? Some word was present. Okay, So if the, see, anyhow, you just need to remember the concept. If this, it would have been mentioned some teeth with less than 50% bone loss, then answer would be class B. And if it is more, a lot of teeth with less than 50% bone loss, then answer would be class C. So depending upon what was there in the option here, with some teeth less than 50% class B, if it is more teeth with less than 50% of bone loss, then it would be class C. So for this, again, you have to see what was the question exactly and what was the options. Okay, so the next question was GCF is not increased in. Okay, so this was again a very simple and a repeat question. We have discussed this a lot of times in the class also, and it's been asked a lot of times in the exam. So that in trauma from occlusion, GCF is not increased and it remains same. Okay, in smoking there is transient increase in GCF. In while toothbrushing and gingivitis also there is increased in GCF flow. But in TFO the GCF flow remains same. So answer here would be A. Okay. Do you still remember any other questions? I had been shared these 5-6 questions, but I know there were some more questions. So if you remember some more questions that were asked, you can tell me so that we can have a discussion. I can tell you the answers or can discuss those questions, because right now I have been told about these 5 questions, these 5 questions that were asked. So if you have some more questions, then we can discuss about it. So just put it in the comment group. If you have some more questions, or you can put it in the group. We can have a discussion over there also. Was there one question on aging periodontium also? Because from somewhere I have heard that there was a question on aging periodontium. The question was changes associated with aging periodontium is. The first option was increased keratinization. The second option was increased width of attached gingiva. The third option was increased osteophytic activity with the bone. And the fourth option was increased vascularity. Okay. So we all know that with aging, the keratinization decreases, the vascularity decreases, and the width of attached gingiva it increases. So the best answer out of this option was increased width of attached gingiva. So if this was one of the question, then answer was increased width of attached gingiva with aging. Okay, so these were some questions that I had got. And I had discussed with you. Yeah, aging periodontium, we have discussed calculus causing bacteria. Do you remember the options, Pranav? Anyone who remembers the options for calculus causing bacteria? Rotation. Mamta, I didn't get your question. Can you please? Rotation may relapse. So okay. So the question was: suppose relapse of orthodontic treatment occurs due to which fibers? So we know the relapse is due to supracrestal or the transseptal fibers. So the answer here would be transseptal fibers. Intracellular calculus forming bacteria. Okay, I would I would request you if you can all think and think about the options, so that I can get an idea what was the question. Was the question intracellular mineralization of plaque occurs due to which bacteria? Intracellular mineralization of plaque occurs due to which bacteria? Intracellular mineralization of plaque occurs due to which bacteria? Was the question like this? Because so trench mouth causing bacteria is trench mouth is basically anag. So anag is mostly caused by spirochetes and fusobacterium. Okay. So what were the options for this trench mouth? So let's first discuss the first question. I am looking for options for calculus. You're just saying calculus causing bacteria. So I think if this was the question, intracellular mineralization of plaque occurs due to which bacteria? Because I have got this question, I think, from some of the social websites, that there was this question, intracellular mineralization of plaque occurs due to which bacteria? So the option on that social media website was Staphylococcus and Streptococcus. The second option was diphtheroid, Prevotella and Bacterionema. The third option is P. gingivalis and P. intermedia, and fourth option was P. gingivalis and A. comitans. Was this the question? If this is the question that mineralization of plaque, intracellular mineralization of plaque occurs with which bacteria? So the best option out in this is diphtheroids, Prevotella and Bacterionema, and Corynebacterium also causes this. So these are the bacteria that are basically responsible for mineralization of the plaque. So the best option in this question would be diphtheroids, Prevotella, Bacterionema and Corynebacterium. Okay. What was the options for trench mouth? Do you remember it? What was the question for Macule's festoon? What was the question for Macule's festoon? So let's come to the next question. Trench mouth. Do you remember the options for trench mouth? Then we'll come to the Macule's festoon question. Do you remember the options for trench mouth? Was it single options like Fusobacterium or P. gingivalis or spirochetes? Do you remember? Any one of you remember the options? Come on, okay. So basically we know trench mouth is anag, and anag is mostly caused by the most important bacteria is spirochetes and fusobacterium. So whatever was there in the option, you have to mark the answer accordingly. The best answer would be fusobacterium and spirochetes. Okay. So if you can recall the options, I can still help you out. Otherwise, this is the best possible answer for this question. Now, do you remember the question for the Macule's festoon? What was the question for the Macule's festoon? Let me see if I have got any question. No, I have not got any questions of the Macule's festoon. Okay, so there was one more question. I think I got it from a social media. That the question was rolled thick band of gingiva present in canine region is. Was this the question? The options were a triangular shaped defect, recession, a cleft and a non-fibrotic zone. So the question was rolled thick band of gingiva present in canine region was. The first option was triangular defect, the second option was a cleft, a third option was a recession, and the fourth option was a non-fibrotic zone. Was this the question? If this question was this, because we all know that rolled Yes, thick rolled band of tissue is Macul's festoon. Okay, and Macul's festoon is a non-fibrotic zone, because where is this Macul's festoon? Basically, it's present near the marginal gingiva. It's a non-fibrotic zone. So, out of these, the best answer would be D, non-fibrotic zone. Cleft. What is a cleft? Cleft still means cleft. Stillman cleft is, you'll see a cut at the center of the gingiva. That's a cleft. So it's not a cleft. It cannot be a recession. It cannot be a triangular shaped defect. So it was again a simple question. He has not given you a direct option of Macul's festoon. So you have to find if the option was Macul's festoon as the option. Was Macul's festoon was present as the option, or the option was non-fibrotic zone? Was Macul's festoon present as the option? If Macul's festoon was directly given as the option, that's the best answer. And if it was not the option, then non-fibrotic zone. Was non-fibrotic zone the option? If Macul's festoon was not in the option, non-fibrotic zone was the Macul's festoon was the option. So that's the best answer to choose there. Okay. Okay, any other questions? Any other questions that you can remember? So I think, were there any questions from implants? Were there any questions from implants? Coaggregation, we have already discussed. It is caused by gram-negative bacteria. The first question was this. We have discussed that coaggregation is mainly caused by gram-negative bacteria. Any questions on implants? Socket shield technique. Okay. So now, what is a socket shield technique? So basically, we know what are implants. Implants are basically used to replace a missing tooth or a tooth that is extracted. So now, what is a socket shield technique? A socket shield technique is also known as a partial extraction technique. Okay. A socket shield technique is also known as a partial extraction technique, in which you don't remove the complete tooth. You leave a piece of tooth attached to the buccal bone, so that tooth and the periodontal ligament attached to that tooth and to that bone supplies blood supply to that bone, and it prevents any bone resorption in that bone. So what happens? You place that implant in such a way that there is a gap between that implant and the piece of tooth where the bone will form. So this is socket shield technique. Socket shield technique means you keep a portion of tooth and you place the implant. Okay, and this is also known as a partial extraction technique. So if you remember the options, I can okay, diagram tha socket shield ka. So basically you will find a small piece of tooth there and an implant. So by looking at that picture, you can easily say this is a socket shield technique or a partial extraction technique. So reverse architecture, the best, it is seen in chronic periodontitis, it is seen in aggressive periodontitis, it is seen in TFO, and it is seen in necrotizing ulcerative periodontitis also. But the best option to choose out of these options is chronic. In chronic, the prevalence is maximum. So the chronic periodontitis is best answer, then is TFO, then is aggressive, and the last option would be necrotizing ulcerative gingivitis. What's this question? Septa and aseptae hypi, I didn't get you. Can you recall the question and the options? I think that's a question. That's a question of microbiology. I think we can discuss with microman so that Mucormycosis and Aspergillus. Any other questions you want to discuss? Or let's do one thing. Whatever questions still that are left, you recall, just put it in the group so that we can have a discussion over it with the complete options, because I can still feel there are a lot of options that not correctly recalled or that's not correct, and still a lot of questions needs to be recalled. So whatever we had right now till now, we have discussed that, and maybe if you have some more questions or doubts, we can discuss that in the group. Okay. I think that's all for from my side for the discussion of perio. Micro implant. What was the question of on micro implant, Mamta? I think that again would be a question of ortho, if it's a ortho implant. What was the question? Do you remember the question? Okay, so let's recall some more questions and options in the group and discuss that. Okay, so thank you so much for today. Hopefully, just wait for the results. The results would be very good for all of you. You guys have worked very hard. So all the best and keep enjoying the time. Have fun.